Systemic effect of the inflammation. Systemic effect of the inflammation, also known as the acute phase response, or it is also known as the systemic inflammatory response syndrome. Systemic effect of inflammation is also known as the acute phase response or the systemic inflammatory response syndrome. In the acute inflammation, WBC is activated and releases the cytokine T1 necrosis factor interleukin 1 and the 6, which causes the acute phase response. And there are the four acute phase responses there. First is the fever, then increase the plasma level of the acute phase protein. Third is the changes in the leukocyte, and four is the other acute phase response. The first topic is the fever. Systemic effect of inflammation is called the fever and the pyrogens. The pyrogen, which the substance which causes the fever, is called the pyrogen. It may be the first exogenous substance, that is a lipopolysaccharides on the microbe cell wall, stimulate the WBC, and WBC releases the endogenous substances like the cytokine interleukin 1 and the TNF. TNF now stimulate the cyclooxygenase enzyme, helping the metabolism of the arachidonic acid, which releases the prostaglandin, which act on the hypothalamic thermoregulatory center, causes the fever. Second is the increase the acute phase protein. Inflammatory stimuli will act on the interleukin 6, interleukin 1 and the TNF. All of them act on the hepatocytes. Interleukin 6 will releases the CRP and the fibrinogen, and the interleukin 1 and the TNF releases the SSA, that is serum amyloid A protein. CRP and the serum amyloid A protein bind with the microbial cell wall and act as the opsonine. Fibrinogen bind with the RBC, help in the Rolax formation, increases the erythrocyte sedimentation rate. The acute phase protein in the acute inflammation help in the beneficial effect, and the chronic inflammation they prolong the production of the serum amyloid A protein and causes the secondary amyloidosis. Next is role of interleukin 6. Interleukin 6 act on the liver, releases the C-reactive protein, which act on the liver cell, bind with the microbial cell wall, acts as an opsonine, increase the innate immunity, and stimulate the classical complement pathway. And the C-reactive protein also acts as the chromatin and help in the clearing of the necrotic cell and the nuclei. The significance of the C-reactive protein is they act as a marker for the CAD, coronary artery disease, which indicates atherosclerosis, indicates thrombosis, and indicates the MI, myocardial infarction. Also the marker for the myocardial infarction, stroke, PAD, peripheral artery disease, and the SCD, sudden cardiac death. The risk reduction measure when there is decrease in the CRP. The condition is cessation of the smoking, weight loss, exercise, or the statin causes the decrease in the CRP. The third point of the systemic effect of inflammation is the change in the WBC. There is leukocytosis occurs when the leukocyte total count is greater than 11,000 per microliter. The count may increase up to the 15,000 to 20,000 cells per microliter, or it increases to 40,000 to 1 lakh per microliter, and which is an immature neutrophil which shifts to the left. This is called the leukonoid reactions, and where the WBC count is same as the leukemia, but it is differentiated from the leukemia. Causes of this increase in the WBC is release of the WBC from the bone marrow by the stimulation of the cytokine, that is colony stimulating factor, human necrosis factor, and the interleukin 1 to stimulate the bone marrow to release the WBC to increase causes the leukocytosis. Or it may also occur because of the bacterial infection, and it causes the mainly neutrophilia. Then lymphocytosis may occur in the viral infections, mononucleosis, mumps, Germanitis. Eosinophilia may occur in the bronchial asthma, allergy, parasitic infection. Leukopenia will occur. Decrease the WBC count is occur in typhoid, liver, rickettsia, protozoa, and the virus.